we're back. Yes. We are now going to talk about culture and medical care and mental health care. Yes. Because it is a thing.
It's a really big thing.
It's a thing.
It's a very big thing. When we actually spoke for the first time, I was driving to teach one of my classes. And so I teach at the doctorate level a diversity class where I basically, I think I told you this, where I'm trying to teach psychologists how to not be racist and how to talk about culture and color in a way that's not damaging to their clients. And, the intention with the university I teach at is actually to raise culturally competent therapists. And we teach a lot about anti-racism and talking about color and how to do that in an effective way. And when we're looking at mental health, especially perinatal mental health, it's impossible to ignore how, mental health looks different if you're someone that's of color.
Correct.
And, on our break, one of the things we're talking about was me being a white passing person and the privilege that I experience in the medical system because I pass as white, and I feel that, my beliefs are respected and they look at me as I'm a competent person and I have something valuable to share. But I imagine that if I look different, it probably wouldn't be that way. There might be a bit more challenge. And so it's a very important thing to talk about. So for me, I'm half Filipino, and so I do identify as Asian. And within my community, mental health isn't something that's really celebrated. I remember when I wanted to become a psychologist, I was like, that type of doctor? Why that type of doctor? I don't get it. Wait, how much money are we paying for this? But
just suck it up.
Yeah, I want to go feelings? What? You're so sensitive. But, it's not something that is celebrated in my community. And, it's very unfortunate because we know that, everyone struggles with mental health, no matter what you look like or where you're from. And we see that Asian American women are actually 50% less likely to seek out mental health care. And when we're talking about the perinatal population, Asian American women are 9 times more likely to experience suicidal ideation than Caucasian women. And so when we look at those numbers, with the Asian community, we're more suicidal, but we're significantly less likely to seek out mental health care. And that's an important thing to talk about.
I agree. And that very similar to Black culture. I obviously through hundreds of years with slavery and everything that's come along until present day, it's hard for us to seek out care as well because of the fact of racism. Let's just be honest.
Use the R word.
Let's just be honest. Racism, racial disparities, and socioeconomic disparity, everything pretty much, and it all revolves around systemic racism. And it's unfortunate because I'm going to give you a quote right now.
Love it.
In September of 2022, Dr. Hoskins, who is the president of the American College of Obstetrics and Gynecologists, made a statement that data shows the leading cause of death for Black, pregnant, and postpartum people is cardiac and coronary conditions. But what the study doesn't go on to say is that the Black population is 3 times more likely than their white counterparts to die from pregnancy-related complications due to racial inequalities.
Absolutely. I mean, it's being acknowledged,
right?
But is it changing?
No.
Right. And I think that's the tough part is at least we're talking about it now. In a different way. Right. But I mean, for it to change, we would have to unravel racism.
Correct.
And how are you going to do that in a country that's built on racism? I think about, my clientele, and the first stop, after giving birth to your child is the OB. And how often does our OB look like us?
Not often.
Right, not often. And, and how often do we feel comfortable that, we can share our fears and our difficulties with this doctor if they don't look like us, if we feel like they can't identify with us. And when we're thinking about the fabric of slavery in this country and, you know, how children were taken, like you're having suicidal thoughts, you're having intrusive thoughts that you're going to harm your child, you are struggling with depression. If you are a person of color whose, you know, culture has experienced this, where they're separated from their children. I mean, look at our foster care system. The disparity is real. Why would you share this with your provider?
Correct.
That would be...
You wouldn't.
Yeah. Right? Like, that would be... I don't know if I would.
Right. Exactly. And it's really hard because you're just... And obviously, in the Black culture, pretty much it's like you keep everything in-house, right? Within your family.
Same with the Asian culture,
And... you're not to go outside because you can't trust those people, which I mean maybe not, right? From what we've experienced, and you know, just other reasons because of growing up through segregation, you know, slavery, segregation, even still today. And it's really unfortunate because we do need help. I know for a fact for myself, again, postpartum, I really struggled. My postpartum anxiety and depression was like out of control. I ended up getting help. I did talk to the doctor, but also the doctor that I saw 2 weeks postpartum because I had a C-section was a Black woman. She was a traveling doctor, and she like had a real long talk with me and was just like, it's okay if you need to use medication. She's like, I know that in our culture, like that's frowned upon, or, you know, you go to God, which I'm not opposed to that, but sometimes you need a little more. And I was just like, okay, like, you know, crying and stuff like that. And I told her, I was like, well, let me think about it. And then she was like, nope, we're getting another 2 week appointment. And when you come back, you'll tell me. Wow. And that's what happened, and I did accept it. I did accept the medication, and honestly, it was the best thing that I chose to do because I was able to like start to function outside of like my depression. And so, but the fact that she, who looked like me, was able to say like, it's okay, you know, and I felt that I could trust her. I felt like she had my best interest at heart. Made me also be like, okay, I'm willing to accept this or to get help.
Do you think you would have told her if she didn't look like you?
No.
That's really sad.
I mean, I don't even necessarily acknowledge that I have anxiety and depression now, like when I am filling out forms or anything like that, because I'm just like, it's not to the point where it's like I function. And I feel like as soon as people see like anxiety and depression, they assume that you're not a functioning adult, like doing the things. So I wouldn't have told.
Wow. Yeah. I mean, and thank you for sharing that. But I think it is a very real thing for a lot of people. Is like if your doctor doesn't look like you, how do you feel like they're going to see you?
Right.
Yeah, it's a very scary thing. You know, and when we look at, you know, culture and mothering practices, you know, one of my best friends, you know, she's Mexican, and we were pregnant. I remember this so well, like sitting eating pancakes right before she gave birth. You know who I'm talking about if you're watching. And we were talking about how do we ask our moms for help, and because the messages that we've received were be strong. Like when you're a woman of color, the message you receive is be strong, be fearless, you can do this, don't take it from anyone, and you got this, you know, which is very empowering. But the message also is if you're struggling, there's something wrong with you. And don't ask for help. And so as she's also a psychologist, we're sitting there talking about how we're supposed to ask our moms for help. And our moms, you know, my mom is an immigrant, and, you know, she takes a lot of pride in being able to handle things on her own. So, you know, just kind of touching on that.
It's true. Like, it sounds like my mom. It sounds like my mom's story. Same thing. Like, you know, she's a very strong woman, and I love that and appreciate that about her. And obviously she helped make myself and my siblings strong individuals as well. And I'm like I said, that's amazing about her. And I feel like she's been able to move and overcome a lot of things because of that. But with that said, I also was like, I remember saying things to her, like initially after having the baby, it was like, did you feel this way? Like, and she'd be like, oh, well, you know, like she would kind of brush it away.
Yeah.
And I was just like, oh, okay, well, maybe like I'm just overthinking it. Like maybe it's not as serious as I think it is in my mind. And she was very much like that. And it's I don't have any ill feelings towards her.
Of course.
She just was like, you'll be fine. But thinking about it later on and hearing stories from my aunts, it sounds like she probably had postpartum depression and or anxiety too.
Wow.
But she just moved through it because she didn't have anybody to say like, maybe you need help.
Yeah.
Right. And so, yeah. And even now, I think when she looks back, she was like, oh, like you did need help. And I was just kind of like, you know, you'll be fine. And that's really what she said. You'll be fine. And like I said, it's just what's in our culture. Right.
Yeah.
And there's no harm in it, but I think us having these conversations more and more, you know, sharing with the younger generations, acknowledging our mothers and our parents and telling them that it's okay because maybe they need us to.
Yeah.
That it's okay to get help.
Absolutely. I mean, even when you think about childbirth, I'm sure that you also came across this article about what happened in Inglewood with, you know, and I actually shared this article with my class, you know, talking about mortality in childbirth for specifically Black women.
Yes.
And, you know, this woman, she chose a Black doctor.
Yeah.
You know, hoping, and she chose a doula because she was very well informed. She was intelligent. She had her birth team. She had a whole plan, but she still wasn't listened to.
Right. Correct. And it happens a lot.
Oh, yeah.
It happens a lot. I currently work labor and delivery, and I experience it. Like I see it happening with all different women. But obviously I see like sometimes a little more with women of color, especially Black women. And there's all these assumptions and I'm just like, but why? That's always my question. Like, why would we do this? Why, you know, these things don't need to happen.
Yeah.
But not every practitioner, not every doctor, midwife, nurse is really standing on business, as the kids say, like about how to like being anti-racist or you know, advocating for that patient and really just being like, hey, why would we do this to them but we didn't do this to that person, right? Which also feeds in not going to get care.
Absolutely. I mean, and you think about the hierarchy system within the medical field, you know, like I'm not in that field, but one of the things that I've definitely heard about from other people is there is a hierarchy and there is, you know, people kind of fall into their role, fall into line based on their education, status, standing in the hospital. And how much room is there for there to be pushback if there is racism that's being observed or mistreatment?
There's room. You have to, I think the thing is that you have to identify your biases first.
Yes.
Like, you have to self-reflect first and realize where your thoughts are and your beliefs are before you can fully advocate. Because then if you realize like, oh, maybe this is happening or maybe, you know, identify the things, then maybe you can and you would feel more empowered to say like, no, that's not okay. But most of us, I don't think, go into our jobs or any situation really reflecting and really thinking about our, like the beliefs that we have for whatever situation and whatever population and putting that to the side. And I don't think our DI, the energy that we're putting into it is going to work until people truly acknowledge their true feelings and beliefs.
I agree. In the class I teach, that's actually what we talk about, and that's how we started. Is, you know, we all have had experiences, and we all have heard messages we grow up feeling a certain way, and no matter how woke we think we are or how open we are, we all hold prejudice against people.
Yeah.
And that's okay.
Right.
And the best way to approach that is actually with self-compassion, trying to take a curious lens of why, like, how was this created? What's going on here? And how can I work on this versus beating yourself up?
Correct.
You have to be able to self-reflect.
Right.
In my class, we actually did an exercise where they closed their eyes and they thought about a time when they actually had a racist experience, with them being a perpetrator or having some sort of prejudiced thoughts.
Yeah.
And, being able to welcome those memories and to choose to do things differently. But that's not easy. You have to be able to be uncomfortable.
Right.
And we're in a culture where we don't want to be uncomfortable.
At all.
Ever. My 75, if anything's over 75 on my thermostat, I'm too hot.
Correct.
Like, we don't want to be uncomfortable ever.
Right.
But we have to be uncomfortable and have uncomfortable conversations with ourselves.
With ourselves first.
With ourselves first, and then we can have them with other people.
Right.
But the other thing, right, when we think about, in a hospital setting, and these big organizations, they have diversity training.
Yeah.
How many people actually want to be in those trainings? It's like
No
skipping
one.
through those videos.
Correct. And I've actually made the comment before I'm like, sometimes I feel like they hate me, the management, but I'm like, this is not gonna work. Yeah. Like, you really need to like make people uncomfortable to like really deal with the thing. So like, it has to be a class like that they have to show up to and like really be in it. Cause just like doing the little computer trainings, I'm sorry guys, but it's not doing anything.
No, that's not.
Because clearly, I mean, the stats are getting worse before they're getting better.
Yeah.
And it's and it's mainly because we don't want to be uncomfortable.
No, it's really hard. And as we talk about discomfort in seeking out mental health care too, like what you talked about, not wanting to acknowledge that you are someone that struggles with anxiety or depression.
Yeah.
And being a person of color, that is another layer to it. It's like, what does that mean about me? What does that mean about my ability to be a mother? And are people going to question my ability to be a mother?
Correct.
Because I'm struggling.
Right. And but then you have like, women having like hurting their kids, killing their kids, or like killing themselves or attempting to kill themselves, especially in that postpartum period. Yeah. Because we're afraid to say like, hey, I'm really struggling. Yeah. And I have a friend, and we're kind of postpartum same time, and I remember like chatting with her in the middle of the night and stuff like that, like, and I'm struggling, can we just talk? And I'm just like, girl, like, I want you to get a therapist, like, I want you to, like, all the things, but she Hispanic, and she, tend to be similar to Black people, and they keep most things in house, and you don't really believe in mental health, services and those things. But I was like, please get help. Like, it's okay. Like, if, you don't feel right, that doesn't make you any less of a mother, any less of a good human. And if we all acknowledge that, we'd probably be in a much better, like, headspace.
Yes, I think as women, we definitely have to, be more honest about the struggle. Yeah. Like yesterday I was at Trader Joe's and I saw someone with her baby and she was trying her best, but her baby was not having it. No. And I looked at her, I was like, girl, I've been there. Mm-hmm. Hang in there. Yeah. And as women, I think we need to do more of that. Mm-hmm.
Like, instead of judgy.
Yeah, instead of judgy, or even silence. Like, silence isn't always golden. Like, sometimes we need someone to be like, hey,
you got it.
You're fine. It's all good. It's all good. Yeah. Especially when you're someone that's of color. Yeah. Like, I think our suffering needs to be acknowledged.
Right.
And it's not always.
But we got to change that.
Yes, I agree. And, so what is the answer? Is it to have more people of color, like, in the field? Is it to, but at the same time, it all comes down to racism. And so we have to we have to just start with ourselves. Like as I'm thinking about solutions, because I'm a solution person, it's like, no, like if we were all to do the work internally about our biases, then maybe, you know, people would feel more comfortable coming forward.
I agree with that. I agree with the fact that we have to acknowledge ourselves first.
Yeah.
But I also agree that having more people that look like us, from our cultures and things like that in those spaces, in the medical field, doctors, nurses, psychologists, psychiatrists, therapists, all, like, we just need more, because that's what our world looks like, right? Yeah. And people who identify with us, then we can open up and, you know, really get the help that we need, the support that we need. And then also looking for, you know, all the practitioners out there, like I said, psychiatrists, psychologists, you know, coaches, you know, things like that. Like, having the support is big. It's big time.
I agree. You know, the other thing is, you know, as a provider, like, the importance of me acknowledging the culture of my client. Yeah. Right. And people are so afraid of talking about color. And, like, what if, let's say, like, you had an OB that didn't look like you, right, but did acknowledge the fact that they don't look like you, and, you know, how that could create a barrier, but they want to be able to support you. Like, they don't necessarily have to look like me for me to trust them, but if they acknowledge what I look like, then I can trust them a little bit more. Right. Like, we don't look the same. No. But you trust me to have this conversation with you. Right. And I'm curious as to why.
Because from our initial talk, I felt like, she's my girl. Like, I feel that it's an easy conversation. It was immediately not surface like level. It was like, we're in it. We're chatting, laughing. It was like kind of no holds bar. Those are the conversations I love. And so I felt like I have a good read on people's energy. And like, I just felt that, like, we could have this honest conversation and it would be good. Like, it would be open. And I guess that's just made me like, oh, I think I can trust her. I think this would be good. Yeah.
And so maybe if providers were like that.
Right. Like, just talk to me. Yeah. So I can get a feel for you. You get a feel for me. Right? Yeah.
But it is tough also because of the time constraints. Correct. You got, 15 minutes or whatever? I think that's what my friends told me. Yeah. It's like 15 minutes. Like, you do the best that you can with that time.
Right. Right. And I think that one of the things that I love about being a nurse is that I do tend to get, like, more history on my patients, like, because I spend time with them, right? Hours with them at a time, and you get to learn more about them and their family and their situation, how they got pregnant. You know, you get to know all about their business. And I think that is helpful, especially when it goes to the time of, like, communicating with the doctor, the provider, and things like that. And where I feel, and I know that the time restraints, but it would be beneficial if our providers did really try to get to know us, know about us. Because then if you know more about me, my life, and maybe I know a little bit more about you, then I feel like the relationship is better, and you maybe understand me better, and you'll help me better because of that fact.
Yeah, agreed. Yeah. Well, this was fun. Yeah. Thank you.